Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every recurrent infection is a real story, and today's topic highlights something many people misunderstand about sexually transmitted infections. That treatment failure is not always because the medicine was too weak. Very often, the system itself was interrupted, because antibiotics only work properly when treatment is completed correctly, and many treatment failures begin quietly through missed doses, early stopping, self-medication, or untreated partners. That is why we approach it from 4 angles: what the doctor evaluates, what the nurse observes, what the pharmacist safeguards, and how the dietitian supports recovery. This is the pharmacist's perspective. In clinical practice, there is a pattern we see repeatedly. A patient develops discharge, burning urination, pelvic discomfort, or genital irritation. Treatment is started, and within days, symptoms improve. The pain reduces, the discharge lessens, the urgency fades. So the assumption becomes, I'm fine now, and that is often where the system begins to break. Doses are skipped, medication is stopped early, leftover antibiotics are reused later. A friend's medication is added without testing or review. At first, this may seem harmless because symptoms may continue improving temporarily, but underneath, the infection may still remain active. So the pattern becomes: start antibiotics, symptoms improve, treatment stops early, bacteria survive, symptoms return later. Not because the medication failed, but because the treatment process was incomplete. From a pharmacist's perspective, antibiotics are not general symptom relievers. They are targeted treatments. And proper treatment depends on correct medication, correct dose, correct duration, and consistent use. Because not every STI responds to the same antibiotic. And when antibiotics are used incorrectly, bacteria adapt. That is where resistance begins. Now look at what commonly happens in real life. Old prescriptions are reused. Different antibiotics are mixed together. People self-medicate based on past symptoms, but similar symptoms do not always mean the same infection. So another dangerous pattern forms: wrong antibiotic, partial treatment, temporary relief, persistent infection, harder future treatment, and gradually infections become more difficult to clear. Then comes another major issue: partner treatment. One person completes treatment, the partner does not get treated. So what happens? Re-exposure, reinfection, repeated symptoms, and frustration grows because it appears the medication did not work. But often the full system was never treated together. Now add another layer: alcohol and medication interactions. Some antibiotics interact poorly with alcohol. This may worsen nausea, vomiting, dizziness, stomach discomfort. But beyond side effects, alcohol also disrupts consistency. Doses are forgotten, timing becomes irregular, treatment loses structure, and once consistency breaks, effectiveness drops. So from a pharmacist's perspective, structure matters. Take every dose exactly as prescribed. Complete the full course even if symptoms improve early. Do not share antibiotics. Do not reuse old prescriptions. Avoid alcohol if advised. Ensure partners are evaluated and treated. Everything is connected. Better infection clearance, reduced resistance risk, lower chance of reinfection, safer long-term reproductive health. Symptom relief is not recovery. Do not interrupt the process halfway. Act early. If you have concerns, call or WhatsApp plus 233 208 7203 for 7. Explore the other perspectives to complete the picture.